Welcome to another episode of Quick Medical Review, where we unpack essential medical topics in under 5 minutes. Today, we're covering the core summary of hypertensive emergencies, a critical topic for anyone in clinical practice. A hypertensive emergency is a condition where severely elevated blood pressure is accompanied by new or worsening target organ damage. While the blood pressure values are often over 180 systolic or 120 diastolic, it's not just the numbers that define the emergency. It's the presence of acute organ injury that makes this a true emergency. These patients may present with neurological symptoms like headaches, altered mental status, seizures, or visual changes, cardiac issues like chest pain, pulmonary edema, or even signs of aortic dissection, acute kidney injury with reduced urine output, or fundoscopic evidence of retinal damage such as hemorrhages or papilledema. In pregnant patients, we also worry about preeclampsia, eclampsia, and HELLP syndrome. What makes this condition so dangerous is the speed at which it can evolve. If the clinical suspicion is high, treatment should be initiated without delay, even before completing full diagnostic workup. These patients need to be managed in an intensive care setting using intravenous medications with continuous monitoring. The treatment goal is not to normalize the blood pressure right away. Instead, we aim to reduce the mean arterial pressure by no more than 25% within the first hour. If the patient remains stable, we target a systolic pressure of around 160 and diastolic between 100 to 110 over the next 2 to 6 hours. After that, further gradual reduction to normal levels can be considered over 24 to 48 hours. It's important to avoid dropping the pressure too fast, as that can lead to ischemia in the brain, heart, or kidneys. However, there are exceptions. In cases like aortic dissection, preeclampsia, eclampsia, or pheochromocytoma crisis, the blood pressure needs to come down more rapidly and aggressively. With appropriate therapy, the outlook has improved dramatically. While untreated hypertensive emergencies once carried a 1-year mortality of up to 90%, modern management has pushed 5-year survival rates to around 70%. The key takeaway is this: not all elevated blood pressure readings are emergencies, but when organ damage is present, swift, cautious, and tailored intervention can be life-saving. Stay alert, recognize the signs, and treat wisely. That's it for today's quick medical review. If you found this helpful, share it with a colleague and subscribe for more clinical gems every week. Until next time, stay sharp, keep learning.